The thyroid's proper functioning is essential for our health. It produces two different hormones referred to as T3 and T4, and its main function in the body is to regulate our heart rate, our breathing, our body's temperature. With women, it can contribute to regulating menstrual cycles. It is also responsible for regulating our cholesterol levels, as well as contributing to our weight gain or weight loss. That's why whenever there is an imbalance within the thyroid, there are symptoms that are detectable and patients can feel quite unwell. The imbalance can be connected to a hyperfunction of the thyroid, which means that your thyroid is producing too much of those hormones, or a hypofunction of the thyroid, which means that your thyroid is not producing enough of those hormones. Either way, there's going to be symptoms. Normally, the symptoms can be various things like heart palpitations, high blood pressure, low blood pressure, a low pulse, things like having brain fog or trouble concentrating, insomnia, headaches, constipation or bloating. You might even experience brittle nails or falling hair. So there's a myriad of different symptoms that can indicate a trouble in the function of the thyroid. What's important to know is that there's many factors that can contribute to that dysfunction. One of the big factors is connected to stress. And when we talk about stress, we're talking about cortisol levels. So abnormally high cortisol levels or abnormally low cortisol levels can contribute to the dysfunction in the thyroid. Other things like medications that you're taking or infections that your body has gone through, things like radiation therapy or trauma, can also contribute to the dysfunction of the thyroid. And one of the big things is toxins, things like pesticides that we can find in food or plastics. Also a buildup of heavy metals within our bodies, which happens gradually, but over time it creates underlying inflammation that can affect your thyroid. So heavy metals like mercury, cadmium, lead can all contribute to a dysfunction within the thyroid. Thankfully, the thyroid is very sensitive to the proper nutrients or the factors that contribute to its proper functioning. And those factors can be minerals like magnesium, zinc, and selenium, or vitamins like vitamin A, D, E, C, some of the vitamin Bs as well, can also contribute to your thyroid health. That's why it's very important to not only test your thyroid hormones, but to also test your cortisol levels and your other hormonal levels, because we need to connect how your body's working, and we need to connect all the different hormones together so that we can understand what the reason for the disbalance is, and we can address it in a proper way.